Thank you all for tuning in, and for those of you who are in person, members of our press corps and videographers, thanks for taking the additional risk. We're taking the precautions we can here. For viewers at home, all the folks here are wearing masks, and they're all 6 feet apart to the extent they can. And several brave members of the press corps are here, as well as our videographers. As we announced Wednesday, I'm traveling to Washington on Wednesday for a meeting with the President. To discuss additional resources for Colorado's recovery and response efforts. It's important for him to hear what's really going on the ground. The fear, the anxiety, the health condition, the economic challenges that the people of the country face. I hope to help bring those to him and make sure that he's aware of what's really going on in the real world. I go there, of course, with some trepidation. I will have to be a traveler, as many Coloradans who have critical jobs in other areas and healthcare workers who volunteered in New York will have to do. I'll be going on a commercial flight, wearing a mask, taking the risks that need to be taken for the people of Colorado. When the President invited me and the Governor of North Dakota for an hour meeting, there's really no way that I could say no to this opportunity to advance the needs of the people of Colorado with regard to improving our federal partnership for supplies, for testing, for personal protection equipment, and really to do my best to make sure that the President is not living in the ivory tower in the White House and is really aware of what's going on across the entire country. I'm certainly going to do my best and update the people of Colorado about how those discussions go. We are very close to 20,000 confirmed positive cases in Colorado. The number is 19,899 as of today. Keep in mind the actual number of positive cases is several times that, right? Those are the diagnosed cases using the criteria we have in the testing. It's likely 2, 3, even 4 times that number of Coloradans. We currently have a total of 3,659 hospitalized, 573 currently in the hospital. And I'm glad to say that 49 Coloradans were discharged in the last 24 hours. We've tested over 106,700 people, and we are at 981 deaths, 981 Coloradans who didn't make it. Reminders that every death is a tragedy, and our hearts and condolences go out to every family in Colorado, in America, and across the world who lost a loved one because of this global pandemic. The daily growth rate in cases continues to decrease. I'm glad to say that thanks to your work at staying at home and social distancing and wearing masks, we had a daily growth rate of 0.9%. This is the first time we've been below 1% growth. Now keep in mind that it's continuing to grow. Daily hospitalizations are down to 0.1% growth, far less than the peak, but that also means that there are still Coloradans across the state going to the hospital for COVID. About 1 in 10 people who contract this virus are likely to need hospitalization. That's why making sure that we have the bed for them, the treatment for them. In most cases, simply oxygen treatment. In some of the most difficult cases, a ventilator, and then there's something closer to a 50% survival rate. But for the 1 in 10 who need to go in, most of those will simply need oxygen, a week, 5 days, 2 weeks, and then hopefully will be able to recover on their own. But just keep in mind that there are very few normal diseases like that. I mean, there's been people who have tried to compare this to a cold or the flu. None of those require 1 in 10 people to be hospitalized. Okay, just a stark difference in the numbers between those normal conditions that exist out there that of course we're worried about, that are minor inconveniences, and the reason that COVID-19, the coronavirus, is a global pandemic. About 1 in 10 need to be hospitalized, and the fatality rate, depending on your age, continues to be around 1 in 100 who contract it, significantly higher for people in their 70s and 80s, as is the hospitalization rate. That's really the reason that so many of the hospitalizations have been, and tragically about half the deaths have been folks who live in nursing homes and senior care facilities, because while we talked about how 1 in 10 need hospitalization overall, it's closer to 1 in 3, 1 in 4 need to rush to a hospital to have any chance of saving their life if you're in your 70s and 80s. That's why it's so important to protect our most vulnerable population. 2 weeks ago in Colorado, we took the significant step of transitioning from the stay-at-home order, ending the stay-at-home order, opening up and transitioning to a safer at home for most people, while continuing to ask those in their 70s and 80s to stay at home whenever possible. And over the past 2 weeks, Coloradans have done a great job strategically and slowly implementing these new ways that we can sustain ourselves and earn a living and sustain ourselves psychologically and economically. And a lot of folks have asked, what are we looking at for those next steps, right? While most things are open, stores are open, offices are open, manufacturers and industrial are open, some of those social businesses, by nature of what they do, restaurants, nightclubs, bars, I know it's frustrating to many, but gyms, and while gyms can be open for personal instruction, they're not open for the general public as the social businesses they are. A lot of people have asked, when can they be open? Because we are all eager. We're eager as consumers, of course, but we also are eager because we care about our small businesses in our state. And we want to make sure that when gyms and restaurants and nightclubs can open, that we still have gyms and nightclubs and restaurants, because they're a very essential part of the fabric of our way of life that we need to make sure that we can maintain and provide opportunities to during this pandemic. So here's what we're looking at. We're looking at, as the stores reopen, the offices reopened, what level of suppression of the virus have we been able to achieve, right? What is that R0 number? What is the contagion factor with the precautions that we're taking, but also the level of economic activity that's returning to normalcy? And what is our ability at each moment in time for testing containment? How much testing and containment can we do? Remember, that was part of the 4-tier model that we look at to see how well we're doing. Protecting the most vulnerable, testing and tracing, social distancing, and masks. That's the formula. So where are we with testing and containment? We'll talk more about that, the tracing and containment side next week. But we gave a detailed presentation on how we're rapidly increasing the testing on our own. Much of it is a state, working with suppliers in South Korea and other places, as well as in partnership with the federal government, another topic I plan on discussing with the president. How can we better protect vulnerable populations during each phase, right? As the general society is able to return to more and more normalcy, we need to do even more to protect the most vulnerable, particularly those in what we call congregate care settings. Seniors living together, nursing homes, senior care facilities. Of course, the paramount question, does our healthcare system have the capacity to help those who are sick, both COVID-related and non-COVID related, right? Because if our hospital wards were full of COVID patients, where would patients go with heart attacks and strokes and appendicitis? We need to make sure that we have the ability to save lives for both COVID-related causes and the standard non-COVID-related causes, which don't go away just because COVID is here. Enough beds, ICU beds, emergency beds, and hospital beds. And then what's the level of risk versus the societal, economic, and psychological benefit? And of course, is a policy sustainable? I don't think any restaurant owner in our state wants to open for a week or two only to have to close again. So we need a very good indication from the data about the sustainability of these steps. And a key part of this plan is measuring the results and reevaluating our approach based on what the data tells us. For example, we know it's about 13 days on average between exposure and when a positive test result is recorded by the state. Not because testing takes so long, we turn them around in 24 hours now, but if you think about it a moment, it takes 4, 5, 6 days from exposure till when you even have symptoms. And if you get sick, it might take a day or 2 or 3 to talk to your doctor to determine if you need a test, get the test scheduled a day or 2 later, the sample is taken, it's another day for the reporting. All these things add up to, good 11, 12, 13 days from exposure to when we know about it as a state. And today, it's just 14 days, 2 weeks since we transitioned from stay at home, which you did an excellent job doing in our state, which is why we're able to move forward with all these additional openings, to safer at home. And so in the next week, we're just starting to see the very first people who could have become infected as the initial restrictions were being loosened, but that's not all the data scientists are looking for. What they're really looking for is the second and third generation transmission. That means when one person is sick, how many people do they infect? in this new world where we're back at work at offices, where retail stores are open. In this world, how many people does any one person affect? That's the R-naught value that we've been talking about for months, the number that will tell you whether this is working. And that's frustrating that we have to wait that long, because we would have loved to have opened restaurants and bars and nightclubs and gyms earlier on. But what the truth is, we have to see how the safer at home is working. And it takes those 2 generations of transmission. How many people does each infected person infect in the way we're living today before we have the data and the science we need to be able to move forward in additional steps? And believe me, I push back hard on the healthcare folks. Can we find out sooner? How can we find out sooner? But it's not because of you or me. It's the nature of the virus, the long incubation period, the number of asymptomatic, the fact that the second there's a symptom, it usually takes a couple more days for people to get tested, even though we have 22 free community testing sites across the state, and many people get tested through their doctor and hospital. So the truth is, we need a little bit more time. We're now just that 1 generation in, 14 days, right? So we need another, week or 2 to collect the data to really understand the critical scientific questions. And that's with me pushing back as hard as we can about getting things going as soon as we can. And this is important because if any state in the country were to go too fast in embracing people getting together again, whether it's at nightclubs or bars or large parties, there would be another wave of COVID infections, and there would need to be either at the county level, municipal level, or God forbid at the state level, even harsher restrictions that are then placed temporarily in that area. And we don't want another wave to set us back from our goals of being able to go stay back at work and go to school and go to summer camp and all those important things. It's important that for our morale, for our economy, and of course, to save lives, that we have this sustainable path forward that's based on data. And that's why we need the time and the data. I always wish in this crisis, even more so than any other crisis I faced in my life, or that our state has faced in our time, that we had tomorrow's data today, that we had next week's data this week, that we had next month's data this month. But we don't. We don't have a crystal ball. It's not the world we live in. So we're acting in real time with the data we have rather than the data we wish we had to be able to move forward as a state. Today I have an announcement about some additional steps, and I'm going to share the timeline for the next big decisions. I'm excited to say that camping can resume in our world-class state park system. Unless, of course, the host county doesn't want it. We respect that. There's some host counties that have state parks that aren't yet ready to open those. But for most of our state parks, camping, of course, is a safe activity. It can be done to observe social distance. Most of our campsites are 50, 100 feet apart. We're accepting campers by reservation only. You can visit cpwshop.com to make a reservation. Now, in people asking about campgrounds, the danger was never really the campground itself. It's great to be in the outdoors. We're blessed. We want Coloradans to be able to be safe outside instead of in stores and in cramped areas with limited airflow. But the danger is when you go camping, in old times, you often would stop in local restaurants and pick up supplies and even refuel. So if you are going camping somewhere in Colorado, either at one of these campsites or the federal ones that are open or on a friend's land, here's what's important. You should fill up your car in your neighborhood, in your area, get the supplies in your area that you need, including the food, and then travel to the great outdoors, recreate, and come back. Don't risk infecting areas that have been freed from the virus, or perhaps acquire the virus in a place that has it and bring it back to your home. We want to limit those interactions and just enjoy the outdoors for the sake of the outdoors, rather than taking this as a tourism opportunity to visit other communities in the state. That's really what's so important. In a few weeks, the U.S. Forest Service will announce their management plan for their developed recreation sites, and we're working with them to provide input and best practices. And the BLM campsites have stayed open, and the U.S. Forest Service has also kept their dispersed camping open. And I'm proud of Colorado Parks and Wildlife. We are one of the few states in the country that's kept our state parks open throughout this entire crisis. In large part because we are, as a state, so connected to the outdoors, and we know that Coloradans have a better opportunity to recreate at a social distance outdoors than in some of the more limited areas that are inside municipalities or inside counties. We know that the outdoors are a big part of our way of life in Colorado,
And as long as folks are distancing properly, camping and hiking and experiencing nature can be one of the most rewarding and also least risky things that we can do, especially while lots of other activities that we take for granted, bars and parties and concerts and sporting events, still aren't occurring. You know, I'm going to share with you a timeline for the additional decision making. And let me be clear, these are not potential opening days. These are the days when we have more data and can make the call, meaning that if we make the call on restaurants, because we'll have the data May 25th, restaurants might need a few days to open. It might be the 27th, 28th, 29th. Or on the 25th, we might say we don't yet have the information and we have to wait another week. I sure hope that doesn't happen. I hope that we have the information because you're doing a good job in social distancing and wearing masks, that on the 25th we're able to give it a go-ahead, and that yes, there'll be at least some in-restaurant or patio dining in May. Keep in mind there already is in parts of Colorado and Mesa County. I think there's a couple other smaller counties that have what we call variance requests in, that the restaurants are going to open soon. They have very low rates of the virus in those areas. But for much of the state, the Denver metro area, the Colorado Springs metro area, northern Colorado, really looking at having the data that we need to make that decision, meaning there'll be 2 generations of transmission, even 3 in some areas. We'll know what the R0 looks like, and we'll also working with the restaurant owners and others to develop those practices that make sense for reopening, right? How can we increase outside and patio dining for the restaurants that can? How do we have the social distancing we need in the restaurants, but also the customers that we need for our restaurants to be able to continue to thrive? After we make the decision with the guidance that will be given, we'll announce the days that it takes effect. Same with spring skiing. We'll have the data we need April 25th. If it's a go in the 2 or 3 areas, it'll just be a few days after that they can likely open. And on May 25th, we can talk about how restaurants are going to be able to continue to exist in this difficult, challenging day and time. We also know, and I know this is the father of an 8-year-old and a 5-year-old, we all want to know this, what's going to happen with summer camps? That means day camps, it means summer residential camps too, and parents and kids are waiting a decision on that. And this will be the decisions for June that we'll be making, but we expect we'll also have that data around May 25th to be able to announce what those camps will look like for June and how they can operate. We already have childcare operating in this state. We hope that we can be a little bit more expansive about camps, but I know it's difficult. It's difficult first and foremost for parents not to know for sure what June will look like for their kids. But it's also difficult for those who operate those camps. Some have already proactively canceled and said, you know, we're canceling June, we're looking at July. Others are saying, you know what, we want to find a way, if we can, to serve kids in June. And, you know, it wouldn't do any good to give that guidance today because we simply won't have the data till May 25th to have the informed guidance and information about what June can look like. And of course, we would also hope that towards the end of June, we will have that guidance about what July will look like, as long as Coloradans are continuing to social distancing, wearing masks when you're out. We hope that we have continued progress. And of course, for June, the safer at home order would be modified. We know that there's a lot of activities people want to engage in the summer, and we're hopeful that things are going in the right direction based on the latest data and evidence. Just like we gave as accurate a picture as we could of May in late April, we plan to give as accurate a picture as we can of June in late May. Always subject to change and always subject to phase-ins, right? Whereas in April 27th, the stay-at-home order ended, we talked about what May would look like. We also know that we talked about phasing in restaurants, meaning, yes, we hope there's in-restaurant dining by the end of May. We still hope that. We'll have the data to show that, and we hope that those last few days in May, that there's a way to do that in more than just a few areas in the state that have it now or will be getting it in the coming days and weeks. But we also know that there could be changes made throughout June. So we'll have what's on for June in late May, and then what might be phased in during June as well. And it really all depends on how well you are staying at home, except when you need to go out, how well you're 6 feet from others and limiting your social interactions, and how well you're wearing masks when you're in public, including in stores. Whether it's an order in your area or not, whether your city or county tells you to do it or not, you should wear a mask when you're going shopping. For yourself, for respect for those retail employees who are putting themselves at additional risk of hundreds of customer interactions, and to protect your families and loved ones, as well as to shorten any economic disruption that comes from the healthcare data. I'm sharing this decision-making timeline because I want to be as transparent as possible as to what the next few weeks look like, what the data is that we're looking for, why, despite me pushing for it, we can't make those decisions today. And, you know, folks are doing a good job keeping up our distance and staying home and wearing masks. We have a lot more flexibility moving forward to look a lot more normal-like. And on the flip side, if folks aren't taking just precautions, it will show up in the data. You're not cheating anybody. It's going to show up in the data. Our hospitals could be overwhelmed if people aren't taking it seriously to be 6 feet apart from others and wearing masks when they go out. And those hospitalizations could tick up. And certain areas of the state, cities, counties, and God forbid the entire state might even need to go in the opposite direction, which nobody wants anywhere. We control our destiny. It's a challenge and an opportunity for us, a test of our individual responsibility as Coloradans, and I know that we can live up to it. I want to make another important announcement today, one that will be music to the ears of parents and kids across the state. A strong literacy foundation is critical for making sure that every kid gets a great education. That's been my focus throughout much of my life. 6 years on the State Board of Education, founder and superintendent of a charter school. I served on the Education Committee in Congress and helped replace No Child Left Behind with the Every Student Succeeds Act. And of course, on the personal level, as the parent of an 8-year-old and a 5-year-old. That's why I've been focused on free full-day kindergarten, expanding preschool. You know, before 3rd grade, children learn to read, and after 3rd grade, they read to learn. The COVID crisis has made it challenging for many of our kids to get that good education. Their teachers and superintendents and principals are doing their best in an online environment to do that. But we need to make sure that COVID-19 doesn't get in the way of our youngest learners getting the skills that they need to succeed academically. That's why I'm so excited to announce a partnership between Rocky Mountain PBS, the Colorado Department of Education, the Colorado Education Association, Gary Community Investments, and the Colorado Education Initiative called Colorado Classroom, Learning at Home. Programming will start a week from today, Monday, May 18th at 8 a.m. For the next 5 weeks, Rocky Mountain PBS provides 2 hours of standards-aligned kindergarten through 3rd grade literacy and English language development lessons by master teachers across the state to students everywhere, from the Eastern Plains to the Western Slope on Rocky Mountain PBS's station. I know that my 5-year-old daughter will be tuning in, and I hope that your kids and grandkids are as well. Rocky Mountain PBS serves 98% of Colorado's households with high-quality programming and no cost to families. That helps get over the gap that not all families have high-speed internet access at home. And it brings high-quality, aligned curriculum in literacy to help ensure that every kid has a strong foundation for moving forward. The initiative features 8 amazing Colorado teachers who will be designing and showing exciting and interactive and fun lessons for students to focus on for literacy and language development. And I want to thank CEA and others for generally providing the funding for educator stipends to our master teachers for their time and expertise. I know my 5-year-old is very excited about Rocky Mountain PBS. I'd like to play a short video of the programming to show you a little bit about what's in store.
Don't let your kids' learning slide. Keep them reading.
I'm very excited to be announcing a partnership with Rocky Mountain PBS, Gary Community Investments, and the Colorado Education Initiative to bring families across the state of Colorado standard-aligned K-3 literacy and English language development lessons by master teachers to kids across our state from the Eastern Plains to the Western Slope.
Got it. I cannot wait to see you and work with you.
Read with me at home. Weekday mornings at 8 on Rocky Mountain PBS.
Don't worry, I'm not in the actual one. It'll just be the teachers talking to the kids. I know that they'd turn it off pretty quickly if it were me giving a lecture about it. I also want to thank One Book Colorado, run by Serve Colorado, the Governor's Commission on Community Service, for featuring archived One Book videos. And if you wanted more information for resources for kids and other free COVID-19 resources, visit stayathomeco.colorado.gov. Stayathomeco.colorado.gov. You might have seen that, like many Coloradans, I also got a haircut recently. wearing my mask, our barber wearing her mask, being as safe as we can, and really getting on in a sustainable way with our lives in a way that's as safe as possible. And for those that are 65 and up, or for those that really want to be as safe as possible, staying at home is the safest thing you can do. But we take risks in everyday life, and our goal is to create the environment with masks and distancing to do things in as safe as possible a way, but also a sustainable way, as close to normal as way as possible. If you're not comfortable getting a haircut, if you're a stylist who's not comfortable giving a haircut, continue to stay at home. But if you are a stylist who wants to give haircuts, you deserve that opportunity to earn a living. And if you're a customer that wants to get a haircut, you can take that informed risk if you choose wearing the mask and being as safe as possible. I have a few additional announcements before we get to questions. On Thursday, a group of local aviators is donating their time and resources to raise money and awareness for the helpcoloradonow.org program through a Flyover fundraising parade and aerial salute to our essential workers. Our family got to watch the F-16s from the Air Force fly over last week for their tribute to frontline workers. We got to do it from our porch, and it was just really amazing to see. We're now excited that 30 aircraft are scheduled to take a flight Thursday, May 14th from 11:30 to 1 in the skies above the Denver metro area, Castle Rock, all the way from the airport in Broomfield to Longmont to Castle Rock. That schedule will be published, but you can watch it again from your own patio, not in large groups, but it should be a lot of fun. And all donations made to the helpcoloradonow.org fund will help go to those who need it the most during this crisis. Organizers encourage people to watch from their homes and, of course, follow social distancing guidelines to have fun. We provided the media with a flight path and times when the parade will be visible in different areas. The Air Force F-16s were about 45 minutes behind schedule. We'll try not to do that, weather permitting, but they were well worth the wait, and this should be a lot of fun, too. We thank our aviators. We thank Lockheed Martin, who provided a $500,000 challenge grant, and all those who are participating in the support around our Flyover fundraising parade and aerial salute to our nurses and doctors and frontline workers. I have an update on the COVID Health Equity Task Force. We know this virus is disproportionately impacting communities of color, and we want to hear from Coloradans. Part of that is hearing from you, so we can have informed responses that meet the needs of everybody. So visit covid19.colorado.gov. Lots of great information there. But click on COVID-19 in Colorado and the Health Equity Response Team to fill out a survey regarding your top concerns related to COVID-19 and disparities. Your response will remain anonymous and help inform the work of our team on this issue. Over the weekend, I know many of us celebrated our wonderful moms and grandmothers and aunts and great-grandparents on Mother's Day. I know I did. And I want to thank everyone who resisted the temptation to have a big celebration, to bring all the grandkids and great nieces and nephews over to mom or grandma. I want to thank everyone who resisted that temptation for the COVID emergency and instead opted for a virtual Mother's Day, a video chat, a phone call, posting photos on social media, celebrating moms everywhere. And on the other hand, like most Coloradans, I was extremely disappointed to see people and businesses actively breaking the law and defying public health orders this weekend. We all have laws that we agree with and laws that we disagree with, but it's our responsibility as Coloradans and as Americans to follow the law. And I join most Coloradans in our frustration watching videos of people illegally packed into restaurants and thinking about all the moms and grandmothers and aunts and everyone who is put at increased risk of dying from this horrible virus. At a state, how well we succeed in social distancing makes a difference between success and failure. At the individual level, the stakes are even higher. It can make the difference between going on living or suffering a particularly agonizing, painful, and lonely death. I encourage folks to read some of the stories of those who are suffering from coronavirus or who have lost loved ones, and imagine that it was yourself or a family member. Cal Lee, who was treated at St. Luke's in Denver, told press, quote, "When I was in the hospital, I was scared. I think maybe I might die and have no time to come home, say goodbye to my kids, my family, and other people in Colorado. Jason Jahanian, a young father and a marathoner, spent a month in the hospital in Aurora, teetering on the edge of death. He lost 25 pounds and was using a walker when he was discharged, from a marathoner to having to use a walker. He implored others to take this virus seriously. He said, "Do it for the greater good. Spend a couple weeks keeping your distance. Let's suffocate this thing and put this beyond us. Trust me, this virus is very real." And there's also close to 1,000 Colorado stories that don't have happy endings. In Durango, 49-year-old John Sanchez passed away from COVID. His daughter said, quote, "My dad was everything. He was the best father, grandfather, son, friend, everything. He was a rare soul. Do what it takes to keep yourself and your family safe. Quarantine. Just take it seriously because this could happen to anyone," his daughter said. His funeral was broadcast over video chat. In Greeley, we lost 75-year-old U.S. Army veteran Rodney Myers. His daughter said, "Can't call if I have a problem, can't call for advice, can't call to tell him I love him. 2 of his grandkids got engaged this year and he won't be able to attend their weddings. Going to miss my best friend, my buddy. We hung out every day, loved him with all my heart." And his stepdaughter implored the public to take this pandemic even more seriously. Quote, "People need to realize that they need to put masks on. They need to stay home when they can because it's not fair to anybody else they'll give it to if they have it," end quote. It can happen to anyone. A 21-year-old baseball player at Colorado Mesa University, Cody Leister, tragically lost his battle with COVID-19 as well. His mother said, "He wore his heart on his sleeve. He was kind to everybody, and he would give his right arm to anybody if they needed it. He was a kind, giving person, and he was taken from us way too young. He had so much left to give to this world," end quote. And there are hundreds of grieving families across Colorado, tens of thousands of grieving families across the country, hundreds of thousands across the world, and they won't be the last. And I hope you join me in praying for and with those families, that they may know solace and comfort, that they may take refuge in the loving embrace of their surviving family members, even if they can't physically embrace them at this time. The compassion we show to our Colorado brothers and sisters in their suffering shines a light for all of us, so we can emerge from this crisis stronger spiritually and more united with our fellows. If you truly want to love your neighbor as yourself, in addition to offering your prayers, you need to guard your actions, because your actions can save people's lives. Maybe even people that you know and love. They're guaranteed to be people that somebody knows and loves. Your forbearance is the greatest gift that you can give your community, and especially the most vulnerable among us. When folks feel the temptation to engage in an activity that may spread COVID-19, I want you to pause and think about the grief that families across our state are feeling, about the souls that we've lost far too soon, nearly 1,000, and the priceless lives that we can still save. Only if we all truly pause and remember our responsibility for one another, our brothers and sisters, will we be successful in navigating and emerging sooner rather than later with more lives intact from this pandemic. My mom is 75. She's watching this. Hi, Mom. And I want her to be with us for decades to come. I want her to see her grandkids graduate high school, and God willing, I hope that she even gets to be a great-grandma someday. And so yes, like most Coloradans, I didn't get to see her in person in April or May. And I didn't get to take her out for lunch on Mother's Day. I love my mom far too much to put her at risk by visiting a busy restaurant operating illegally just to take a selfie with omelets and a mimosa. Colorado, America, we are better than that. The most effective way to limit the suffering of our fellow Coloradans and ourselves, and to get our economy back on track sooner rather than later, we want to be one of the first states back, not one of the last states back, is we need to obey the public health orders that save lives and reduce the duration of this economic disruption. And this is what's important for business owners to understand. Customers will return en masse when they feel safe. When people see videos of people packed into a restaurant with no social distancing and no masks, people feel less safe. and the widespread economic pain will only be prolonged. We're walking a tightrope between protecting all of our health and, of course, trying to grow our economy. It's hard enough to walk without folks shaking the rope because of their own ideological or anti-scientific views, which they choose over the lives of our brothers and sisters. And so I have an announcement today. The Colorado Department of Public Health and Environment believes that the C&C Coffee and Kitchen in Castle Rock is causing an immediate health hazard. As such, CDPHE and the state are using their authority under the Colorado Food Protection Act to take action and suspend the license of the business indefinitely, probably for at least 30 days, until it can be established that there's no longer a threat to the public health until the hazards are removed. We know that Tri-County Health is also working on enforcement actions, and we are supportive of those efforts. It's very sad when businesses operate illegally and workers lose jobs through no fault of their own. Some businesses that operate illegally might face costly court battles, or even worse, the deaths of employees, owners, or patrons. Now, I saw on social media, and I'll go to a few questions from the general public before we go to the press, and I want to stress how strongly I disagree with this. Many people said that those people deserve to get coronavirus, that they deserve to give it to others, that perhaps the whole city or county deserves what they're going to get. That's not a Colorado value. We hope and we pray that nobody who went to C&C Coffee and Kitchen had coronavirus. And we hope that everybody is safe who went there. Here's the situation. And it's likely that in one instance like that, hopefully, knock on wood, hopefully nobody had coronavirus. But if that was emulated in other parts of Colorado, in Douglas County and elsewhere, if there were not just one restaurant that did that, but 40 or 50 restaurants that illegally operated in Colorado, well, in any one of those, it's certainly possible that there wouldn't be coronavirus. Just looking at the odds and who has coronavirus in the statistics, it's almost a statistical and epidemiological certainty that if 40 or 50 restaurants did what C&C Coffee and Kitchen did in Castle Rock, at least a couple of those would have coronavirus outbreaks, because there would at least be one or two people with coronavirus, mildly symptomatic, asymptomatic, and it would go to tens or dozens of people in that kind of packed-in, illegal environment. We take the laws of our state seriously. And as citizens, as residents, we don't have to agree with every law. I don't. I try to change them. That's part of what I work with the legislature on. There's a lot of laws I'd like to change. I'm probably not going to get my way on all of them. Nor should I. I'm just part of the process, as you are as a voter. But we all believe in the rule of law and need to follow the laws and work through legitimate channels to change those laws. Our state legislators, the ballot initiative process. We don't have the ability to simply violate laws and threaten others. I hope, I pray, that nobody falls sick from businesses that chose to violate the law. But if the state didn't act and more businesses followed suit, it's a near guarantee that people would lose their lives, and it would further delay the opening of our legitimate businesses that want to follow the laws in our state to keep their customers and staff safe, if we weren't serious about enforcing the law. As governor of this great state, and as a big believer in the free market, I'm disappointed when businesses break the law and subject themselves to legal penalties. What they're doing, potentially causing their own employees to lose work, potentially causing themselves to go into default and not even make their rent payments, is a failure of their fiduciary responsibility to themselves as owners and shareholders, and it's a failure to our state as a whole. My administration will do what is necessary to preserve the rule of law in Colorado in good times and bad, which is the oath I took when I became governor of the great state of Colorado. And I call on all Coloradans and all businesses and individuals in our state to each do our part, to exercise caution, to follow the law. Of course, you can use your freedom of speech to object to laws that you disagree with. But in the meantime, we follow the law. It could save lives and ensure a return to economic and social normalcy as soon as possible. Don't ruin it for others. Don't ruin it for yourself. We need to observe the law. I have a few questions from online, and then we will go to questions from the room and from our friends in the media. First one is, Governor, please answer this. When will concerts, sporting events, and gatherings of 10 or more be allowed? Please answer. That's one of the reasons that I talked about our timeline today. I would love, you would love, we all would love to say, guess what? Next week we're back to concerts and sporting events. We need the data that we don't have yet. After pushing back as hard as I could, I still concluded that we need to wait for that second generation of transmission data under Safer at Home, meaning by May 25th we can make the call. That's unlikely to include those big concerts and sporting events at this point. Although I'm hopeful as a baseball fan that baseball's newest plan is to resume games as soon as July without fans, but we're going to work with all of our teams and be in line with where others are nationally with regard to our professional sporting events coming back. Lisa said, the Catholic Church has been doing baptisms because they can't postpone them. If they are postponing burials, they can postpone baptisms. So burials, baptisms, rituals that are important to people for religious reasons absolutely can occur. It's the festive celebrations around them that often can't, right? So I've gotten so many questions, do I have to delay getting married? No, you can get married. We've actually made it easier to get married. You can actually, we waive the in-person requirement. You can basically get married online now with the notary service. The celebration might have to wait. The religious ritual of a marriage, of a baptism, of a funeral, in many religions, including my own, the religious component of a funeral has to occur within a limited period of time, and it should occur. But that celebration of life, that it might involve dozens or hundreds of family members talking about the legacy of that person and remembering them in our hearts and in our minds, that's what has to wait. So do what we need to fulfill the religious rites associated with cycle of life events, and then we will have that day where we can come together around celebrating the cycle of life events. Jim said, sad day when desperate business owners risk a future shutdown to satisfy their actions despite our health department. It is a sad day that some irresponsible business owners are risking more people losing their jobs and greater economic disruption, out of their own anti-science views or their own ideological views. And finally, Jen said, I took a connecting flight for mandatory work purposes from Denver last week to Connecticut through Chicago. I was disappointed, shocked, and amazed how only about a third had masks on in the Denver airport. The United plane was packed. Only a few brought their own masks and others had to wait. The United flight attendants handed out the masks to those who were too ignorant to bring their own. When I landed in Chicago, everyone, and I mean everyone, had their masks on, from babies to the elderly. Look, let's do better, Colorado. I'm going to have to go through DIA this week. I'm going to be looking at others. I can tell you I'm going to be wearing a mask every moment. Denver, we can do better or as good as Chicago. I know we can. Let's up our game. Both United and Frontier, our two major carriers, and many others require masks on aircrafts. That's a good step. Let's wear masks if you have to travel. It's important for everybody. And whenever you are in public, it's important to wear a mask that covers your mouth and your nose to help make it as safe as possible. With that, we'll open it up for questions. We'll start with the room. Yes.
Governor, thank you for taking the question. I'm looking for that gut reaction when you first looked and saw the crowded restaurant in Castle Rock. That's my first question. The second one is, when you go to Washington on Wednesday, you described some people there living in an ivory tower. What will you tell them Colorado needs the most, and will you wear a mask when you meet with President Trump?
I was frankly disappointed, like most Coloradans, when I saw that video. I was so disappointed that anybody would be so irresponsible and put their own business at risk of closure with the indefinite closure for hazardous health conditions that would jeopardize their patrons, probably even friends or loved ones of the employees and the owners. It's really disappointing to see that. And at the same time, I really hoped that they would be okay and safe throughout this, and I continue to hope that there aren't additional cases that were spread through that irresponsible behavior, even though it would be a statistical guarantee that if many folks did that in many places, it would lead to increased transmission. We can certainly hope that this was a statistical anomaly and that nobody had COVID-19 at that site. I will be, of course, wearing a mask throughout the process of getting there and going through the White House. I understand a number of Secret Service agents have been contracted COVID. I will take every precaution that I can to be able to be as safe as I can during this. And I think what's important at the White House and at the President here is just the real difficulties the American people are facing from this virus. Many Americans are out of work. They worry about where their next rent payment is going to come from. They worry about the virus. We worry about having the equipment we need to help battle the virus. The President has said a number of times there's plenty of testing, there's enough testing. Well, I'll present our numbers to him and tell him how, while we're making progress on testing, we would like to do a lot more. And our nation as a whole needs to do a lot more, testing and tracing, to be able to get out of this. And I look forward to making sure that he really hears that, what's going on in much of the country, including in our state of Colorado. Telephone, please.
Governor, this is Vinny Dalgiudice at Bloomberg News in Denver. As you noted, Tri-County Health stepped in the closing of the Castle Rock Cafe. But what can the state do if local authorities won't cooperate on enforcing rules stemming COVID-19? Can the state step in on its own, and can criminal cases be pursued at this point? Thank you very much, sir.
I personally don't think that criminal cases should be pursued. It's up to the local sheriff and the DA. But Colorado Department of Public Health and Environment is using our authority under the Colorado Food Protection Act to suspend the license of the business indefinitely until it can be established that there is no longer a hazard to public health.
Thanks. Governor, you talked about R0 and social distancing as the key measures you're using to decide how well we're doing. But what's going on in terms of calculating those numbers in real time? I know most of them come from CU Anschutz, but they're not posted on the CDPHE website. Where do you expect to get those numbers? When do you expect to get those numbers? And can you give us a sense of what's good, what's bad, and what might trigger you to close things down a little bit more?
Both our state modeling and most national modeling, and again, I look at all models. Of course, we have our great models designed by the folks at CU Anschutz. I try to look at every model we can see. Most of them have shown that R not, that means how much one person is given it to, during the stay-at-home phase was around 1, 0.9 to 1. I mean, every person who had the virus gave it to about 0.9 to 1. We still need to be in about that 0.9 to 1.1 range. Obviously, the lower the better. If you can get below 0.9, that's great. But really in that 1 to 1.1 range for this to be sustainable. If it gets much higher, then we need to figure out where are those transmissions occurring, how do we have the minimum number of restrictions that can actually succeed in reducing that viral infection rate. And this time around, we hope to have a lot more intelligence on that, a lot more visibility into that because of the tracking and tracing. Are people getting it at their grocery stores? Are people getting it in their neighborhoods? Are people getting it at their work? What kind of work? That's the kind of information that we need to get. We already know that places where people live together are at greater risk. And that means senior care facilities, it means prisons, it means youth incarceration facilities. That's why we're taking the strongest steps around those areas, including directing testing of asymptomatic workers to our senior care facilities across the state, starting with the very largest, both with the Colorado National Guard, as well as with our partnership with CSU. So it's only been 13 days since the safe at home period ended. So there isn't yet the data from the safer at home period to know where we are. We knew when we presented this that we needed the social distancing. It was at 70 to 75%, right, during the stay at home. It needs to be in the 55 to 65% range during the stay at home. That will be reflected in what the R0 rate is, but there's simply no data to point to because we're just seeing the very first generation cases after safer at home went into effect. We need to see, and this is what I'm saying, the data May 24th, May 25th, when then there will be 2 generations, even 3 in some places, of what transmission looks like under safer at home, and therefore what level of social distancing we've succeeded in achieving, and what the effective R0 value in Colorado is at that time. Telephone?
Governor Polis, David Clue at Denver 7, thank you again for your continued accessibility during this crisis. It was about 3 weeks ago that you said you did not go into this pandemic expecting assistance from the White House or the federal government, that Colorado would pretty much be on its own. What's changed, and has your reluctance to criticize the administration led to your hopes for greater success on this week's trip?
I'll work with anybody and everybody to help the people of Colorado. And I think that's my job, and that's what's important. It's not about ideology. It's not about party. Of course, the federal government has been an important partner in this. We've had to often go around them, sometimes even in competition with them, to acquire the supplies we need, buying masks and gloves in the international market, buying supplies in the international market. But they have also been a supplier with us and for us, whether it's 100 ventilators, whether it's the swabs that they're sending, whether it's the project that we're working on with them to deliver additional masks and protective equipment to our nursing homes. So we live in a nation. I wish that the federal government had done a better job from the onset helping states collaborate rather than compete against one another. But we are where we are. We work with anybody and everybody. And of course, I'm going to continue to try to make our president aware of what's going on the ground in states like Colorado, and hopefully elevate our partnership to help save lives in Colorado.
A little bit about how the 10-mile travel rule interacts with the allowance of camping starting tomorrow, and how that can be confusing to people. Are you dropping that 10-mile rule? And then also I was hoping you could address the state's efforts to secure remdesivir, which I understand FEMA basically has a stranglehold over the supply.
Yeah, so when people are going camping or hiking, it's not just camping, you may go on a day hike. Here is, and this will be reflected in subsequent, formal guidance, but I want the people of Colorado to use their common sense here, and here's what that means. Fill up your automobile in your local area, get the supplies you need from stores in your local area, including food, and then yes, you can go hike or you can go camp, and then you can return home. We don't want people spreading the virus to other areas of the state, which can happen at refueling stations or at stores, or if you live in an area with a relatively low rate, potentially bringing it back to your community after your community has worked so hard through Safe at Home and now Safer at Home to contain the virus. So those will all be included in the guidance that will be going live today around the Parks and Wildlife campsites, but it also really applies to other camping and other hiking in Colorado. Be smart, respect host counties, meaning some host counties aren't ready for visitation yet. We respect that. They don't have the legal authority, and some have even tried this to actually shut down their roads. They can't do that. But they're our fellow Coloradans, and nobody has more at stake economically and from a health perspective than those who live in those communities. And we should empower them to make the decisions about when they're ready. And our Parks and Wildlife operates parks in many counties across the state. And of course, we're going to be sensitive to those counties and where they are, as they will. As many counties have made different decisions with their own open space, different municipalities have made their own decisions with their own municipal parks. Remdesivir, there has been a limited allocation for Colorado. The GERC is determining the standards of care that are associated with that. The supply is very limited nationally, and if it continues to be clinically promising, we hope that the supplies continue to increase. And of course, we also hope for and await even more significant breakthroughs. Remdesivir is promising, but I want the people of Colorado to know it's not a game changer. The clinical studies show that there is very likely some benefit therapeutically from remdesivir, but it's not a game changer or a cure for COVID-19. Telephone?
Governor Charles Ashby from the Grand Junction Daily Sentinel. I hate to ask a camping question followed by a camping question, but Jesse's always stealing my thunder. So I'm wondering how this is going to work, how it's going to get rolled out. How are you going to deal with shared spaces, limited gathering, swimming beaches, And I realize that your discussions with the president is going to go beyond camping, but what are you telling the federal government when it comes to their campsites?
Yeah, so I do plan to talk to the president about U.S. Forest Service and BLM and just the value of that continued partnership to make sure that they're in sync with where we're going as a state and providing healthy outdoor opportunities for Coloradans to recreate in a safe way as possible. The guidance will be going live very shortly, and Colorado Parks and Wildlife will be empowered to immediately open the reservations for campsites, open them as soon as tomorrow in the areas where they're ready, and then likely to phase in some of those shared facilities. So showers and yurts, even cabins, they need to, over the next few days, develop those protocols. So I would expect the campsites to be open first, and then we've empowered Colorado Parks and Wildlife, working with healthcare officials at the state level as well as counties, to phase in those additional options in as safe a way as possible in the coming days and weeks.
Why did the state not intervene yesterday while this big Happy Mother's Day event was happening at the restaurant? And then also moving forward, if there are others who host such large groups, what can they expect in terms of enforcement?
Under the Colorado Food Protection Act, if any business is causing an immediate health hazard, then their license will be suspended indefinitely. And that goes for any business that is causing an immediate health hazard. This is a very immediate reaction, of course. Douglas County Health is also pursuing, I think, cease and desist orders or other ways of doing that through the Douglas County courts. But I think the imminent health hazard is clearly documented, and it's unfortunate that the owners and the employees of C&C Coffee and Kitchen will have to suffer the economic loss of a prolonged closure, while other restaurants and cafes across the state are likely opening and welcoming customers. It's really unfortunate that they'll remain shuttered indefinitely until they can resolve the health hazard.
Bueno, para Noticias Univisión, el fin de semana abrió un restaurante en Castle Rock y además unos salones de fiesta. ¿Qué piensa hacer la gobernación para tomar medidas para la ley? Y si serán sancionados o no estos locales.
Hoy anuncié que ellos pierdan su licencia, su permiso para operar su restaurante desde un tiempo indefinitivo. Sí, acabo de anunciar que el Departamento de Salud del Estado utilizará su autorizada para suspender la licencia de este restaurante indefinidamente hasta que sientan que ya no van a ser una amenaza para la salud pública. Es muy importante para todos los negocios y la gente de Colorado vivir en un vía consistente con las leyes y los órdenes de nuestro Estado. Son importantes para su salud y también importante para nuestra economía. Last telephone question, please.
Hi, Governor Polis. This is Libby Smith with CBS4. In the situation with C&C Cafe and Kitchen, part of what the owners gave us as reasoning for their actions is that the government hasn't done enough for small businesses. What is your response to that?
Well, if they're referring to the federal government, the participation in the Paycheck Protection Program that gives 2.5 months of cash flow to Colorado businesses doesn't help meet the needs of every business, but has really helped so many small businesses. I was glad to see the average loan amount was relatively small. We'll get you the information after, but it was in the high tens or low hundreds of thousands, meaning it hit its mark, not just multi-million-dollar businesses. It was $50,000, it was $80,000, it was $130,000. A lot of those loans really hit the mark for small businesses. We also have done everything that we can to make sure that restaurants can get through this, meaning they can do the curbside delivery with liquor, they can do takeout, they can do delivery. Many restaurants are struggling to get by. We know that. We hope that they're able to open as soon as possible. But this is what's important. Just because you disagree with the law doesn't mean that you get to violate that law. We all disagree with different laws in our state, including me as governor. But we all honor those laws because we believe in the rule of law here in Colorado and here in America. Thank you so much. And we're going to do We're going to do the Wednesday briefing. I will be doing it from Washington, D.C., probably in a studio there if I can get access immediately following my meeting with the president. I'll be giving an update on that meeting as well as anything else that's going on from Washington. I wish me luck and safety on this trip, and I look forward to visiting with you on Wednesday. And I hope that Coloradans, and I know that Coloradans, will continue to remain 6 feet apart where you can, wear a mask in public, and continue, particularly if you're over 65 or have a pre-existing condition, continue to stay at home whenever you can. Thank you.
Does this mean they might not be able to open until June? Is that still up in the air?
I'll answer that in just a moment with
Thank
my
you,
mask.
sir. Thank you, Governor. Sound like when you meet with the president.
So I'd express my hope that I share with restaurant owners, that I share with, I think, all Coloradans, that restaurants can open in May. I still am confident that there will be limited opening in May, but I can't make that decision until we see 2 generations of transmission data from the Safer at Home phase, and that will be May 24th or 25th. It would be likely that restaurants might need a few more days to open. So if we make the decision the 24th or 25th, it would be my hope that restaurants could be opening 27th, 28th, 29th. Keep in mind that there are likely areas, there's already areas of the state where restaurants are open, Grand Junction area. I expect that there will be other areas, some of the smaller counties with very low virus count, could very well open restaurants sooner. But in terms of statewide, in terms of Denver metro area, I am still cautiously optimistic that we'll be able to open some in-dining services and especially patio services during the month of May. Thank you.